My name is Kelsey Moon. I'm a student nurse at the College of Nursing, and today I'll be performing my medication administration checkoff. So I'm going to start by scanning my room, ensuring that I have a working space for my patient. The first thing I'll do is verify my order comparing with the medical record and MAR. So I say we have an order for heparin 5,000 units subcutaneously every 12 hours, heparin 5,000 units subcutaneously every 12 hours. Now I'll locate and verify the 5 rights: Jaguar-Jones, right medication, heparin, right dose, 5,000 units, right route, subcutaneously, right time, every 12 hours. It has not been done today, so we are good to go for that. Now I'll locate his allergies, so I have it noted on both that he is allergic to penicillin. Now I'll perform hand hygiene, and then we'll ensure that I have the right medication and compare it to the MAR. So we have heparin 2,000 units per milliliter, and we have an order for heparin 5,000 units per milliliter. Now I need to check the expiration date on my heparin. It has not yet expired, so we can use that today. I'm ensuring that I have the right time for administration, so we have every 12 hours. Verifying my right route, subcutaneous. So for the subcutaneous heparin injection, you will need a TB syringe, a needle assist, and alcohol swab pads. Okay, now I need to verify the correct dose to give my patient. So we have on hand heparin 2,000 units per milliliter, and we have an order for heparin 5,000 units. So I'll be administering half a milliliter of heparin, and we'll compare that calculation to my MAR. So it says heparin 5,000 units or half a milliliter. Now I'm going to grab an alcohol swab pad and we'll cleanse the top of my vial. Okay. Then I'm going to grab my syringe and we'll remove the cap from that and attach it to my needle assist. Okay, so then I'm going to pull back about half a milliliter of air. Okay, so then I'm going to remove this cap and place it down. And now that my vial has had time to dry, I will then insert my air and will then withdraw half a milliliter of heparin. So there's no bubbles. That is amazing. Cool. Now I'm going to recap my needle using a scooping mechanism. So I will scoop. Cool. And then disattach this tip. We'll then reattach it to the appropriate needle. And we'll leave that there. Now I need to verify my dose with another nurse, so they will compare my calculations and verify them, which they have, so that's sweet. Now I will compare the prepared medication with the MAR and label of container. So for the right patient, right medication, right time, right route, and right dose. Now I need to make a label to take to my patient's room. So we have our label maker. So you want to have your patient's name, Jaguar-Jones, right medication, heparin, right dosage, 5,000 units. And then you'll attach that to the end of your syringe. And now I'm going to proceed to my patient's room with the MAR and my prepared medication. Then I'll perform additional hand hygiene. And now I need to ensure that I have the right patient, so I'm going to look at my MAR, my patient's armband. I see we have Jaguar Jones, medical record number 4176352, 4176352. I have it noted on both the record and his armband that he's allergic to penicillin. Mr. Jones, I have it noted here you're allergic to penicillin. Do you have any other allergies I need to be made aware of today? No? Awesome. And then I will perform any necessary pre-administration assessments, blood pressure, pulse, just whatever is needed for that specific medication. Now I need to reassess that I have the right medication and compare it with the MAR. So we have Jaguar Jones, the right medication, heparin, the right time, every 12 hours, the right route, subcutaneous, and the right dose, 5,000 units, or half a milliliter. So, Mr. Jones, today I'm going to be administering half a milliliter of heparin to be subcutaneously in your abdomen, if that's all right with you. So sweet, thank you. And then I would raise my bed to a comfortable working height and lower the side rails. Now I'm able to don my goggles and a pair of clean gloves. So before I give my injection into the abdomen, I want to assess the integrity of the skin. I do not see any bruising, so we are good to go with administration. Before I give that shot, I want to be sure to cleanse the injection site with my alcohol swab pad. So you'll clean in a circular motion all around and leave one end of that pointed towards where you last cleaned, so you know where to give it. Today I'm going to be giving this injection at a 45 to 90 degree angle, so I'll remove that. So I want to remove my cap. And now that I've allowed time for my patient's skin to dry, I'm going to spread the skin, being mindful of where I just cleaned, noting that loose skin is harder to penetrate. So, okay, Mr. Jones, you're going to feel a small stick. So I'm inserting at a 45 to 90 degree angle, insert, slowly insert my medication. Okay, and then I will dispose of it properly into my sharps container. So then I will assist my patient back to a comfortable position and raise my side rails. I am then good to remove my gloves, my goggles, and we'll need to perform additional hand hygiene. So after giving my injection, I want to be sure to observe my patient for any allergic reaction. Then I would need to document the procedure on my MAR, noting the patient's response of the administration of the medication. So I'm doing this to ensure that I have properly implemented the 6 right of the patient, which is the right documentation. And after I did all this, I'll return to my patient at a later time to see how they responded to that medication and complete some medication administration checkoff.